This is Golden Years, a roadmap to navigate retirement with Mark Cordner, the podcast.
There was an article from Kiplinger that mentioned the old saying, it's not what you earn, it's what you keep. And that definitely relates to taxes. So when you look at the biggest expense in retirement, taxes are often overlooked because many think that they can't change what they owe. It is what it is. Uncle Sam says this is it. But there's actually a good tax strategy that can show otherwise. So, Mark, talk me through this.
Oh, I may have to restrain myself on this because this is a favorite topic. I mean, the truth is that most people don't think consciously of taxes. It's something that we want to mentally avoid. But the reality is many people approach retirement with this unfounded belief that they're going to somehow be paying less, because for the last 50 years, Wall Street has been perpetuating this idea that we're all going to retire with less income and therefore we'll be in a lower tax bracket. And the truth for many retirees is that's not the case. They may well have more income than they had during their working years, or they may simply have lost, for example, their favorite tax deductions, things like the mortgage interest deduction that they were accustomed to, the benefits of having children in their home. Now it's grandchildren and the government doesn't give you a break for that. They may have given a lot of money towards charities during their working years, and they're not giving as much money to charities. They're giving time instead. And what does the IRS think of your time? Well, nothing.
Nothing.
They don't want anything of your time. And, we're not contributing to our retirement plans, our 401ks and all this in retirement. So some of these deductions that were our best friends throughout our working years kind of vanish away in retirement. And people find themselves, strangely enough, paying more taxes sometimes in retirement than they ever anticipated. And really what it boils down to is groceries. And people think I'm sometimes trying to exaggerate this, and I'm not. I mean, the last couple years of rampant inflation has made stunningly clear to most of us that certain government behaviors can put us in situations like this rampant inflation that suddenly make groceries twice as expensive. Or if we're going into retirement with a limited income and suddenly they start raising tax rates for reasons related to historical spending patterns, for example, the government may be forced to increase tax rates in retirement, and suddenly we're able to keep less of what we thought we had earned. And so this is actually a really, really, really big deal. And so we've got to get clear on our beliefs about taxes. Do we believe, for example, that tax rates are going to go up? If we believe that, then are our behaviors, are our assets in alignment with that belief? Do we have most of our money in taxable accounts or perhaps in never before taxed, tax deferred IRAs, for example, because all that money is going to be taxed. The earnings on the taxable accounts and the tax-deferred IRAs, for example, that money is all going to be taxed when it comes out in the future. And that surprises many people. If we are going into what I absolutely believe is a rising tax environment, then we need to prepare ourselves for this. And so it boils down to a story I'd love to tell you. There's a story, and it may be apocryphal, I don't know, but it comes from Judge Learned Hand, who was an esteemed jurist on the federal tax courts, I believe back in New York. This was many decades ago. Judge Learned Hand, what a great name, Learned Hand. He had all these statements that first-year law students always learn in their first year of tax, the first weeks of tax law. And he says a number of things about how there's two sets of tax rules, one for the informed, one for the uninformed, and so on. But there's this story that may be apocryphal where he supposedly invited a clerk of his over to a window of his office, and he supposedly looked out this window and there was this river there, and he pointed out that there was a bridge not far from their building that they could cross, and by paying a toll they could get home very quickly. But then to illustrate, and what he was talking about was the difference between tax evasion and tax avoidance. To illustrate the concept, he said, look down the river. You notice this such and such other bridge a mile down the river. If we're willing to inconvenience ourselves, we can still get home without paying the toll tax. We can go to the second bridge and by inconveniencing ourselves, still get home. And so I jokingly say that this difference between tax avoidance, which is totally legal, that's the idea of inconveniencing ourselves and getting home in a kind of a roundabout way, versus tax avoidance, which is crashing through the toll gate. Unfortunately, that was lost on Wesley Snipes, and he ended up going to jail, which is too bad because I love him as an actor.
It's true.
But tax avoidance is completely legal. Tax evasion is not. What we're talking about is legal strategies, legal means of getting off this train track, as it were, where there's a total crash, a mess coming up in the future. We can take steps to get off of that and avoid the increased taxes that are coming in the future. And at the end of the day, it's really about groceries. I find most people have, because they have too much money in taxable and tax deferred accounts, they not only pay too much in income taxes, but they also end up paying in unexpected taxes on their Social Security benefits, in additional costs for their Medicare Part B premiums. And so what they believe, namely that taxes are going to go up, and what they're doing, which is having too much money in taxable and tax deferred accounts, is at odds with each other. I often say this is like driving down the freeway with one foot on the brake and one on the gas. It makes for a bumpy ride. We're not being consistent. We need to get our actions and our philosophy in alignment and behave accordingly if we want to reduce taxes and actually have sufficient groceries in retirement. So don't leave this to chance. Come visit with us. If you have questions about how to legally avoid taxes in the future, there are absolutely strategies for doing this legally. There are tools that you can take advantage of, but you have to act.
Along with the taxes, the conversation about just the cost of healthcare, those seem to be, some of the top two conversations that are really popular with you recently, Mark. And, one study said that a 65-year-old couple with median prescription drug expenses needs nearly $300,000 in savings for a 90% chance of having enough to cover healthcare in retirement. Just want to say that again. They need at least $300,000 in savings. This is just normal, everyday, nothing crazy with prescription drugs here. So when you factor in that into a financial plan, how do you figure this out? Is it a lump sum that you do? Is it an annual expense? How do you factor in, these inevitable health issues down the road that could wipe out our retirement savings?
Oh, I love that you bring this up, because this healthcare issue and taxes are the two biggest issues that I converse with people about. I'm told by studies that less than 7% of advisors even talk to their clients about healthcare strategies, which stuns me, because that's, in my mind, gross malpractice. Medical expenses, and in particular long-term care expenses, are the number one unfunded liability going into retirement. And retirement is really about risk planning. So what you're referencing there is actually a study that Fidelity puts out each year. The numbers are actually higher than that now. They're closer to 330 or more, dependent upon the study you're looking at. But Fidelity comes out every year. Fidelity, again, the investment group, comes out every year with a healthcare study. And it's not about necessarily having $300,000 at the start of retirement set aside for all these expenses. It's about being able to cash flow that kind of expense over the course of your retirement. And so what we're talking about here is acknowledging that Medicare does a very good job of providing skilled medical care for people over the age of 65. But Medicare doesn't cover everything. Medicare only covers 80% of our healthcare expenses. And so if we want help with the other 20%, we end up getting Medicare supplement plans or Medicare Advantage plans to help with that. But, if we're dealing in the world of Medicare supplements, then we've also got vision and dental and hearing services that are needed. And those are not covered expenses. Those are things we're going to have to cash flow or get some kind of insurance for. So you think of co-pays and deductibles on these health plans, and suddenly that, with your monthly Medicare Part B premiums, which right now is about $360, roughly $350, $360 a month for a married couple, plus all these uncovered expenses. So yeah, it's not hard to get up to $300,000 when we do the math on a 20-year history. And the prescription drugs, my heaven, I'm on a ton of prescription drugs right now, and they're expensive. And we put out many thousands every month between my wife, myself, and my son, just for uncovered prescription drugs. And so that's another big shocker for retirees. They kind of think that everything's covered under Medicare. Yep. And that's absolutely not correct. Medicare is wonderful, and you need to have a good broker who can help you, find the right Medicare plans for you. But you have to understand that a lot of things are not covered by Medicare. And long-term care, that's the unskilled, custodial, hands-on kind of care that we need as we get older and more frail. That's definitely not covered by Medicare. So all of the $300,000 doesn't include long-term care, believe it or not. That's just talking about the skilled medical care and prescriptions.
Right.
So it's a big chunk of change. And if we're not prepared for that, then we're going to get hurt. You've heard me say this before. I talk about building a moat around the castle. The purpose of the castle is to hold the treasury. I lived in Europe for 6 years, particularly when I was a child. I was fascinated by these castles, but the moat is our protection against those outside invaders, which in our older years becomes the healthcare providers. They're the ones that are trying to invade our personal treasury, and science and technology are prolonging our lives, but they're not paying for it for that, longer life period. So we have to absolutely consider this in our planning. So we'd love to invite people in to talk about this. We have what we call a discovery session, kind of a good fit kind of session to see if we can work well together, but to discover in particular where the weaknesses are. And healthcare is always, always, always a big issue for people. And in the rare exception, most people have not prepared for retirement. And so come visit with us. Let's take the guesswork out of this. Let's do some math together. Let's look at what types of protection do you have in case things get really, really costly in the future. If you have not addressed healthcare cost in your do-it-yourself planning, then you're going to have some scary times ahead.
We all know that the road to retirement can be a little bumpy, a little confusing, a little overwhelming. So you have to ask yourself the question, does having a financial advisor make a difference in investor confidence? Well, there was a new Alliance report that found that less than 25% of adults have a financial plan or an advisor, and over 40% believe they may run out of money. Of those that don't have an advisor, a whopping 70% said they were confident they wouldn't run out of money, with 3 in 4 utilizing an annuity. I know I just gave you a lot of stats there, Mark. Take it in there. Would you say that one of the greatest benefits of financial planning is really offering confidence in their financial future? I mean, that's what you're there to do.
Yeah, I actually think that's the greatest benefit, in fact. And it's the most important and critical one because it's the anxieties that we have stepping into this new, out of this certain life, this the structure of our working lives for 20, 30, 40 years, stepping out of that into this great unknown. That can cause tremendous stress for people. And so it's important to have an outside perspective, and particularly when it's a well-educated and experienced advisor that can give you that perspective. The numbers that I see are actually a bit different than that, because what they basically say is that those who don't have a written plan of some type, basically the reports say that there's undue confidence out there. A lot of people think they're going to do better than they are, and once they have a written plan, then the actual numbers actually go up from how well they're going to do with versus without the plan. So if they use an annuity or not, it's to be seen, but bottom line is we have people come in all the time who go to our educational classes, and a lot of them are do-it-yourself types, and we discover very quickly that they haven't considered things like healthcare. They haven't done the math on the fact that, at 3% inflation within 25 years, the cost of living is going to be twice what it is today. Things like this, they haven't done the math on, and that's why you see all these letters to the editor from retirees complaining about how their utility costs have gone up and how all these costs have gone up, and they're on a fixed income, and the world's cruel and all this kind of stuff. And it really has to do with the fact that they weren't prepared. Conversely, the fun experiences are when we have people come in where we're able to do an analysis with them and say, hey, why are you working? And literally,
that's great to hear.
I've had people get very, very emotional in front of me because they thought they had to keep working. And we're able to show them how, no, you don't have to put up with that boss, or you don't have to put up with this situation, or yes, you can go take care of such and such family member, whatever their circumstances were. I can think of a number of specific examples. A widow that I worked with even recently, of course, and I mean, heaven, what a horrible thing for her, in early 50s to lose a spouse unexpectedly, and then have this sense of going from a known safe situation to a very uncertain future, not knowing what's coming. Will I be okay? And for us to be able to look at the financial picture and say, not only will you be okay, you'll be very okay.
Yeah.
You'll be better off actually than you thought. Even with him. She's in a much better situation. And so those can be wonderfully emotional private moments, with the clients where they see possibilities for the first time. And in some cases, it may be scary for those who didn't, the do-it-yourselfers who weren't thinking of inflation, for example. But for others like this widow, or I think of some of my favorite stories are these single moms that have just deprived themselves for years, taking care of their kids and doing what's right and trying to sock away whatever they could. And I'm able to look at them and say, well, you could retire now. And frankly, you're better off than the doctor that you're employed by.
Wow.
I happen to know the doctor situation kind of thing. And so I'm not divulging that to the client, but you're better off than the people that you thought.
Yeah, but that's good news. I'm sitting across from you. You're telling me that. I'm doing great.
Yeah, it's not that it's a race with other people, but at the end of the day, we need to have that confidence. That's the biggest thing for a financial advisor. So I say, come on in, let us visit with you. You should leave having some very helpful information shared with you and being encouraged by the opportunities either to do more than you thought you could, or the opportunities to fix things before they're a problem. Either way, you come out better off.
Exactly. And you're exactly right. Whether it's, hey, by the way, you've got plenty, you've done great, call the boss now, or it's, hey, I know you've been a DIYer for a minute. Some things you missed were inflation or taxes, or you had this gap of money over here. I'm so glad you came in because you would have been hurting when you turned 80 years old. I mean, whichever side of the coin, you're going to walk out feeling better and obviously benefiting from that conversation. And, when it comes to working with a professional, again, you've got over 3 decades of experience, Mark. I mean, think about when your car makes a funny noise. What do? You take it to the mechanics. And let's say something doesn't feel right. Do you go to the website and try to diagnose yourself? Maybe sometimes, but 9 times out of 10, you go to the doctor, right? You go to the professional and you say, fix me, help me, get me on the right track to where I need to be. You have to think of Mark as that professional, that doctor, that mechanic, whatever role you want to put him in here as your financial guy to get you to and through retirement. And that leads me to talking about, yes, we want confidence in our retirement plan, Mark, but what about those that are maybe looking for a second opinion? Because these days, a recommendation goes a long way. Oh, my best friend, my brother, my sister, my mom told me to call this guy. So I guess I met with him and I guess he's going to plan my retirement. So what do you say for those that are looking for that second opinion, possibly with you, and they have little experience to compare which side of the coin's better financially?
That's a great question. And it really goes back to your earlier comments, because we're in a period of history where Dr. Google, as it were, prevails. There is no dearth or shortage of information. There is, in fact, too much information out there, conflicting information, frankly. And what's missing is the wisdom to interpret that information, the experience to interpret it properly. And so we want to get with financial advisors who are experienced, who are well-educated, who can give you the perspective that will help. And so on the second opinion idea, the truth is that there are 2 different camps out there in the financial planning community. And by far, the vast majority of advisors have spent their entire careers focusing on how to grow money. And so typically the whole pitch that the wealth management community gives to people is, whatever you're earning, we can give you 1 or 2% more. Come to us. And that's basically their pitch. We can earn you a bit more. Well, the truth going into retirement is that there's a lot more to this game. The rules are entirely different on how retirement plans work and how we need to utilize products differently to build the guardrails in, the structure needed to assure the income that we need so that we never run out of money. And so it may be that you have a wonderful, wonderful advisor who may be a friend or neighbor, brother-in-law, whatever. Very commonly, people come up to me after my public workshops and they'll say, oh, I wish I had heard this stuff. Why didn't I hear it before? So I get into that whole conversation, why they didn't hear it before.
Right.
But I really like this guy. What do I do about this? And there's ways to get out of relationships, but the bottom line is you need to find a good one before you start jumping ship. And the second opinion is where that comes in. I think I gave an example to you in a prior conversation about me personally with my medical doctors. I was very, very sick the last couple of years with long COVID, and people closest around me didn't think I would survive. And my primary physician was not hearing what was happening. He just kept thinking that I wasn't eating well with my diabetes and yada, yada, and it was really different issues. Well, I found an alternative medicine doctor who literally saved my life. And so sometimes it's just the realization that the prior advisor, doctor, mechanic, whoever, may have been wonderful for that season of my life, but I've now aged into a new season of my life, and I need a different kind of specialist.
Yeah.
And in my case, a different kind of specialist literally saved my physical life. And I've had people come in very recently who had been given, frankly, some really bad advice from prior advisors who were simply trying to push products. And so we were able to take them through a process where in some cases they frankly had to go before the IRS and do some things to fix some past mistakes, bad advice, but we can get you to a safer position. And so the second opinion, that doesn't cost anything. Just come in, let's have a conversation, and you follow your gut. If your gut has been telling you that something's not right, or there may be more to this than what I've been told previously, well, then it's incumbent on you to act on that gut feeling that you have.
Right.
And have the conversation. Learn for yourself. Is there more? Could I do better? And I'm absolutely convinced that those who focus in the income planning and the true retirement planning field, not the growth of money field, but the true retirement planning field, we talk about things like healthcare, we talk about safety. Those kind of planners can literally save your financial life.
Investment advisory services offered through Golden Years Financial LLC, a registered investment advisory firm. Insurance is offered through Golden Years Insurance Services. These firms do not provide legal or tax advice. Consult your own legal and tax advisors before taking actions that may have tax implications. Investing in securities involves risk, including the potential loss of principal. Insurance contracts principal protection is based on the claim-paying ability of the respective insurer. None of the information contained on this website shall constitute an offer to sell or solicit to buy a security or insurance product. The information and opinions contained on this site or requested from this site are provided by third parties believed to be reliable, but accuracy and completeness cannot be guaranteed. They are provided for informational purposes only and are not a solicitation to buy or sell any of the products mentioned. Any media logos and/or trademarks contained herein are the property of their respective owners, and no endorsement by those owners of Mark Cordner, Golden Years Financial, or Golden Years Insurance is stated or implied.